This is Best Way to Smoke Weekly News, and I'm Big J, back with some news. Make sure you stay elevated at all times. I know I will. This is breaking news. Dr. Oz launches Medicare hemp pilot program. CMS, which stands for Center of Medicare and Medicaid Services, and Dr. Oz is the administrator. You know, he was appointed administrator by Donald Trump. So Dr. Oz has officially activated the Substance Access Beneficiary Engagement Incentive. The historic pilot program introduces a federal sanctionized pathway for Medicare beneficiaries to integrate hemp-derived products into their medical care, which is a good thing. So, you know, people that's been around for a long time and that uses these products understands that it is beneficial. But as we plateau into this other area of bigger business and the government getting more involved with it, you know, it's going to come with stricter guidelines and, you know, more testing and stuff like that. So here's some key highlights of the BEI program. Clinical-led access. The program is not a walk-in benefit. Access is strictly managed by physicians who must determine if hemp products are safe and appropriate for a patient's specific care plan. You know, as with anything, when you go to a doctor, you know, the doctor makes the choice on if it's going to be something that's actually beneficial for you. So here's another key highlight. It's zero out-of-pocket costs. For eligible patients, participating providers can furnish up to $500 worth of eligible hemp products per year at no cost to the beneficiary. You know, that's a good thing to provide some kind of, you know, deduction on the products that you're gonna need, though. But as we move further and as the government gets more involved with it, though, the price could go up. You know what I'm saying? To where, you know, $500 could help, but it might not be enough to actually give some people what they need for the whole year for 12 months. So here's another key highlight. Strict product standards to ensure safety. The pilot program only allows oral administered products. Inhalables, vapes are strictly prohibited. Okay, so that just means, you know, gummies, tinctures, and things like that. Chocolates, cookies, you know, stuff in that realm. Products with 0.3% Delta 9 THC or less, aligned with the 2018 Farm Bill, a cap of 3 milligrams of total THC per serving. Rigorous third-party testing for potency and contaminants. That's always a good thing. You know, the rigorous third-party testing for the potency and stuff like that, and for contaminants, because we definitely want to get a good product. We don't want nothing that's actually contaminated. That's a must. You know what I'm saying? That we get something that's actually tested at a high rate, and just hopefully, you know, they're doing the right thing to make sure it's right, though. But that 3 milligrams of THC, I don't know, Playboy. So now the target enrollment, the pilot is currently limited. The beneficiaries align with specific innovative center models, including ACO REACH, Accountable Care Organization, EOM. Expansion of the lead model is scheduled for 2027. So here's another key highlight. The CMC will use the pilot to track data-driven discovery. CMC will use the pilot program to track health outcomes and prescribing trends, seeing if CBD can reduce the need for more intensive medications to inform future Medicare coverage policies. Okay, so now here's the breakdown. The Substance Access BEI marks the first time the federal government is acting as a payer for cannabinoids. While Medicare is not directly reimbursing for the products, providers fund them as an incentive to improve care coordination. It signals a major shift in federal health policy. Led by Dr. Oz, the program aims to provide a safe, supervised alternative for seniors who are already using CBD for chronic pain or cancer symptoms, replacing over-the-counter guesswork with medical oversight. So, with everything that's happening, in this industry, there's some good things and some bad things. If we can get this product out there to where it's actually being spread, that it's beneficial and helps people and can get to people, that's always and definitely a plus. And also getting the rigorous testing that needs to be done to make sure there's not contaminants in it that can actually cause more harm than it can cause benefit. That's a good thing, but there's always a catch to it. So we're going to have to wait and see what the catch to it, what else is going to come from this. So on that note, make sure you stay tapped in with Best Way to Smoke News with the number 2, and follow us on every platform, man. We got some great things coming, man. This is Best Way to Smoke Weekly News, and I'm Big J. Make sure you stay elevated at all times.